When the pandemic started, people rushed to buy disinfectant wipes and harsh chemical sprays, and you couldn't find Clorox wipes anywhere. Some people even resorted to fumigating their offices and businesses. But now the CDC says all of that might not be necessary. News 13's Courtney Allen joins us live from home with the story. Courtney?
Jess, the CDC says the risk of getting COVID from a contaminated surface is extremely low. One Albuquerque business says that's part of the reason they're happy with the simple measures they've taken to keep their office clean.
Each day, workers at Cosmetic Dentistry of New Mexico wipe down all surfaces. While some other businesses across the country have turned to what some call theatrical cleaning measures like fumigation, Dr. Byron Wall says they decided a year ago not to go that route because they didn't want staff and patients exposed to the disinfecting chemicals.
There were a lot of talk about fumigating, putting a lot of chemistry up in the air to hopefully kill and drop the bacteria, or drop the viruses out. Turns out this really isn't necessary.
Updated CDC guidance released this week says the risk of COVID transmission on surfaces is less than 1 in 10,000. And the CDC says in most cases, fogging, fumigation, and electrostatic spraying are not recommended as primary methods of disinfection.
I guess it feels good, but I think it feels good to know that we've been doing things all the way along that keep people safe.
The New Mexico Poison and Drug Information Center tells News 13 that these kinds of approaches may be less effective, create a false sense of safety, and may introduce additional health risks.
I'm super happy that we didn't fumigate in the office because I do have fibromyalgia, and so I do have chemical sensitivity from that.
Doctors at UNM Health say while the possibility of infection from contaminated surfaces is low, the risk is still there.
The recommendation is to still disinfect, particularly if there is a known or suspected COVID positive person in a facility in the last 24 hours.
The dentistry office is also doing a handful of other measures like disinfecting masks with UV light and adding air purifiers to every lab. No one on their team has gotten COVID, and Dr. Wall says they've all been vaccinated. Back to you.
All right, thank you, Courtney. The CDC says cleaning surfaces using soap or detergent is enough to reduce risk in most situations.